Hi, this is Dr. Bharadwaj. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics related to Bartholin Cyst. There are different techniques used in the surgery of Bartholin Cyst. One of the major surgeries is Marsupialization. So we will discuss deep into Marsupialization, whether it is useful or not, are there any alternatives to Marsupialization, how painful it is or how disadvantageous it is. Completely we will look into Marsupialization technique, one of the surgeries for Bartholin cyst, okay, or Bartholin abscess. You all know Bartholin abscess is an abscess that is developed in the women's vaginal area. See, you have two Bartholin glands on left side and right side. So when these glands get infected, that we call as Bartholin cyst or Bartholin abscess. So you can see here, this is vaginal area and this is Bartholin cyst. So this is just to recap. And what marsupialization says. So in marsupialization surgery, what happens is they will cut this cyst like this, they will open it, they will drain all the pus out of it, they will cut some part of this cyst so that sutures will be easy. Then what they do is they will avoid the cyst, they will bring the inner edges outside and suture like this, okay. This is the technique they will be doing. So what are all the disadvantages of this technique? We will look into it now. Yeah, you can see first incision and drainage. They will put an incision and drain it, suture the edges of skin, and what it happens is whenever the fluid is accumulated inside the Bartholin cyst, it continuously drains for many days, okay. This is the technique known as marsupialization. So what are the disadvantages of marsupialization? The whole purpose of marsupialization is to prevent the abscess from occurring again and again, but this is not guaranteed. Most of the cases where I have seen, it reoccurs. So that is one of the major risks we have. And next one is infection risk. See, you know that women's vaginal area is a very sensitive area and a lot of pathogens or bacteria will be around it. It is very easy to get it infected again. There is lot of pain and discomfort before the surgery, during the surgery, and also after the surgery will have a lot of pain and discomfort because you have to keep a pad. So that is a very sensitive area and you have lot of sensitive nerves in that area. So all that area is disturbed. That's the reason it will be painful and also discomfort. Delayed in healing. So this is the area where it is concealed. It is not exposed to air or something like that. A lot of blood supply as well. That's the reason the healing gets delayed here. It is not like once you cut any wound outside and it gets healed quickly. It is not like that. The healing of the wound is also delayed. Major thing is scar formation. So that is a very sensitive area. There will be a lot of scar formation in that area. Because of the scar formation, there will be cosmetic disfiguration. Cosmetic disfiguration can be so pushing of vagina to one side. There are a lot of cosmetic disfiguration can happen. So the symmetry of the vaginal area will be lost and it will be ugly to look after the surgery. And one more important thing is because of reoccurrence, there is high chance that even after the surgery, Bartholin cyst is reoccurred. Because of that, what they do is they will do cyst excision. They will remove the complete Bartholin gland. Once the Bartholin gland is removed, Bartholin gland is very important to keep the vagina moist. So it is very important during sexual activity. During sexual activity, what happens is lot of Bartholin fluid is released into the vaginal area so that it becomes moist and it becomes lubricated. Once you remove that Bartholin gland completely, your vagina becomes dry. Not only during sex, at other times also it becomes dry, and you will have lot of pain during intercourse. So these are the disadvantages you have for marsupialization when you have Bartholin abscess. Under the disadvantages, so if you want to see a video how this marsupialization is done, how the space beside the vagina is cut, you have vertical lips, right? Some part of the vertical lips is completely removed so that it can be sutured easily. All these visuals are there in the video. I will provide the link for that video. That is a very good video to watch. So you will understand how this marsupialization is done. Definitely watch the video so that you can see how painful it is and what happens, especially scar formation and cosmetic disfigurement, how it happens. You can see in that video. I will give you the link of the video in the description. You can see in the description. So do you want to have all this, or are there anything that can be done to come out of this? So there is very good thing in homeopathy. We use constitutional treatment or local treatment with homeopathy. There are a lot of advantages. What advantages we have, we will check in the next slide. How homeopathy can help you in this regard. First one is cure. See, one woman is getting Bartholin abscess and one woman is not getting Bartholin abscess. The reason is not the abscess. The reason is something happened in the body so that they have the tendency of Bartholin cyst. We will remove the tendency of the Bartholin cyst. Once the tendency of the Bartholin cyst is removed through medication, there is high chance that it will be prevented. In almost 95% of the cases where they get treated with homeopathy, there is no recurrence. Only 5% women get recurrence, but 95% of the women who treated for Bartholin cyst will prevent the cyst from coming again and again. Next one is cure. In 95% there is complete cure. I have treated some thousands of Bartholin cyst patients around the world. Not even one patient went for surgery. All the patients is treated with homeopathic treatment and the success rate is more than 99%. Okay, no women went for surgery who came to me for Bartholin cyst. One or two women went for surgery. That too, they are afraid of the words told by the allopathic people or gynecologist has induced fear into them. Because of that fear, they thought that something would happen and they went for surgery. Other than that, most of the patients, 99.99% of the patients did not go for surgery. In 1 or 2% of the cases, what happens is, I have seen these cases also, until you give medicines, Bartholin cyst will be reduced. Once you stop the medicines, they will get the pain again. But it is very rare case, only in 1 to 2% of the cases it will happen, not more than 1 to 2% of the cases. Next one is safe. Homeopathy medicines doesn't have any side effect, not even single side effect. I have not seen any side effect when I am treating Bartholin cyst. So such safe it is. And effectiveness, we have already discussed, success rate is 95%, completely cured and completely prevented, it will not come again. But 1 to 2% we can only give relief. Once you stop the medicine, you will get again. That is effective. See, different diseases in homeopathy will have different success rate, but success rate for Bartholin cyst in homeopathy is 99%. You can say in almost all the cases where I have treated, no one went for surgery and every woman is happy. Not only the recent Bartholin cyst, I have treated the cases where the woman is suffering for last 30 years recurrent Bartholin cyst, or some women just get this now, maybe 1 month ago or 2 months ago. Most of women will come and say that, sir, my marriage is within 2 months or 1 month. Can you do anything? Yes, homeopathy works. You don't need to go for surgery. So none of the patients went for surgery. That's what I mean to say, timely. So homeopathy works timely. If you have in acute condition, acute pain, it works well. Or if you want to prevent a long-standing diseases which is over 30 years, so you can use homeopathy. Homeopathy is timely. Many people think that homeopathy is slow, we will have to pay, suffer with pain. No, in acute cases, homeopathy acts very quickly and gives the relief to you immediately. That's the reason you have to consider homeopathy for Bartholin cyst treatment. And we are Fidicus Homeopathy. We offer you two types of consultation. One is online consultation and in-person consultation. In online consultation, you can have audio or video call with us. So we will discuss all your problems, and if any investigations is needed, you can get them done locally and send the reports to us. And if it is online, so we will ship the medicines to you, and if you are in India, you will receive the medicine within 3 days. If you are in US, it will take 4 business days, and if you are in any other country than US, it will take 5 business days. We are giving this opportunity throughout the world. We have the patients throughout the world, not only in India. Lot of foreigners will come and take treatment with us. Or else if you want to come in person, inquire about the nearest branch. We have lots of branches and you can meet us in person. Next one is why you have to consider Fidicus Homeopathy. Fidicus Homeopathy, you have the highest chance of health here, and we have the highest success rate for Bartholin cyst can compared to any other homeopathic individual doctor or a corporate hospital. Our treatment will be transparent. We will give you the information black and white. Nothing is obscured or nothing is masked. We will give true information to you and you will get the personal care. So all our doctors are very kind and they will recognize you by name, and the personal care you get from Fidicus Homeopathy is topmost. So that's the reason you have to consider Fidicus Homeopathy for Bartholin cyst or abscess. Thank you.